Good day, thank you for watching the Bulletin. With me I have Mr. Simon Baloyi, the Senior Vice President for Sasol here in Secunda. And I'm just like to know, good morning first of all, thank you for speaking to me on the Bulletin. I'd just like to know, we have this mass vaccination, what is the plans behind that?
The plans are around the mass vaccination is to make sure that as Sasol, we can partnership with the government to make sure that we accelerate the vaccination program. The reason behind that is to ensure that we can quickly reach herd immunity. As you are well aware, in 2 months' time in September, we'll be having the September shutdown. So it is our desire that the whole Secunda region might be in a state of a bubble, where most of the adults and people that are actually qualified for the vaccine are already vaccinated. So we have this drive of trying to get everyone who can get vaccinated to be vaccinated.
Thank you. So the aim is to try and get the whole workforce at Sasol.
And our employees and the service providers, both our employees and service providers. As you can see today, we're not just vaccinating our employees, we're also vaccinating the service providers. And that is also a way for Sasol to show that we care for our community.
Mr. Baloyi, thank you. The big thing that I wanted to ask is you've also now only received your vaccination today. You said you'll tell me how it felt. You never did. How did it feel?
No, it feels great. I mean, it actually feels great. I mean, I know right now as I'm speaking to you that my immune system is busy building antibodies that should I get COVID-19, it will not affect me adversely. And also, I mean, this reminds me as well, when we were children, I mean, remember if you look at your child, you get so many vaccines. And this is a chance for us as well to get the vaccine so that we can get rid of this virus. We've seen the vaccines, how they've helped us with polio, with measles and chickenpox. That as soon as the vaccine came in, those diseases left us. And we know that with COVID-19, it's exactly the same thing that we need to do. We need to get all of us to get vaccinated. And I know personally, there's lots of people that are anti-vaccine because they don't understand yet. But we should not be almost stigmatize them. We must actually try and educate them, let them know how vaccines work, and they must know that these vaccines can really help us to get rid of this COVID-19.
I had mine when they did the drive at the taxi rank.
Yes.
So I got mine there. But I wanted to ask you one thing, and this must probably be the last question. How did COVID, because we are I just heard I think it was the Premier or the MEC for health said that we are the epicenter. How did that affect the operations of Sasol? Because I know at one stage you had a high infection rate at Sasol.
Yes, from a Sasol point of view, we did take measures early on to protect our employees. I mean, whether it was sanitizers and masks and social distancing, we took measures like also allowing some of our employees to work from home. And what it did for the guys that were at work, we also split our shift systems to go to minimum shift. Okay. So what that allowed us to do is that even though some of the guys were getting infected, we can send them home and bring other guys that we've kept at home to protect them from the virus. And by so doing, we're able to at least continue our operations. And as you know, since March last year, Sasol never reached a stage where we could not run our plants.
Thank you very much.
Thank you
the message that we bring out to people is go and vaccinate.
Yes, please go and vaccinate. Vaccinate, make sure your family, everyone who can vaccinate, make sure they're vaccinated, because we know that vaccines will help us beat this virus.
Thank you very much.
Thank you very much.